Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. This week's topic is stroke prevention.
A stroke occurs when either a blood vessel in the brain gets blocked by a clot or a blood vessel in the brain bursts. The more common of the two is the blood vessel getting blocked, which is about 80% of all strokes, and the less common is the one where the blood vessel bursts, which accounts for about 20% of all strokes.
Does age play a role in the possibility of a stroke?
Stroke does occur more commonly as you get older, although we do see people who have strokes even as children. But 3/4 of all strokes occur over the age of 65. So, of course, as the population ages, we are going to see more people having strokes as time goes on. So as you get older, the vessels in your brain tend to stiffen, and you also get more plaque buildup in your arteries. And there's also another condition that becomes more common as you get older, which is called atrial fibrillation, which is where the heart, instead of beating regularly, starts beating irregularly, and that can form a clot in the heart, which can then travel to the brain.
How can you assist someone who is having a stroke?
The most important thing to do when you recognize someone is having a stroke is to call 911, because time is brain. Every minute we can save between the time the stroke starts to the time we can get treatment in, which includes either a drug in the body or a device to remove a clot, reduces the disability from a stroke. And you get to the hospital faster when you're taken there by an ambulance.
What is TPA and how does it help treat stroke?
TPA stands for Tissue Plasminogen Activator. You can think of TPA as a clot dissolver, much the same way if you have a clogged pipe, you'd put a solvent down to try to dissolve that clot, and sometimes that works. And TPA works for some people who have had a stroke. The traditional time window for TPA was 4.5 hours, but there has been a brand new study that's just come out, and we can now give the drug up to 9 hours with special imaging. UMass Memorial is a comprehensive stroke center. We were recently certified by the Joint Commission, and there are special requirements which go into becoming a comprehensive stroke center, including having the ability to mechanically pull clots from arteries. UMass Memorial has a dedicated suite where people can have clots pulled out, and these are highly trained physicians who do these procedures. Another key component is having a neurocritical care unit where people with severe neurological injury can go to receive highly specific care for their needs. It's such a time-sensitive disease. For people to have to travel to other places to get their care would inevitably lead to worse outcomes for them. So this is a very important component for the community.
How can the moniker FAST help diagnose a stroke?
The easiest mnemonic to remember is FAST, which has to do with the symptoms people have. So somebody can have asymmetry in the face where it looks crooked, or they have a drift in their arms. So if you have them hold up their arms, it either drags down, or you might notice that one side of the body is not moving as well as the other. S stands for speech, where the speech either becomes garbled or they're difficult to understand altogether, or they have trouble understanding the kind of speech that you're saying to them. And then the T stands for time, which is the key component trying to get them to the hospital as quickly as possible. We tend to think of stroke as just an older person's disease, but many of us know people who are younger who have had strokes. We see people who are teenagers who have strokes, 20-year-old people who have strokes, and it can be very devastating. So it's important to realize that these people also need treatment because it can affect them for the rest of their lives. And because we have these modern treatments, we want to treat everybody, regardless of their age, so that they can have the best possible outcome.